Thank you very much. It's a pleasure to be here. I've actually never given a talk before for breakfast, so this is somehow I feel a little upside down for that. Well, let me get right into it. I hope everybody's awake, or if not, I'll try to keep you awake with a little quiz. Okay, we'll come back to this, but who are these people? Okay, I would think everyone here should know at least who perhaps two of them are. I hope it's clear. The one on the picture on the left I actually took from a YouTube, okay, and the one on the right we'll get back to. But just sort of keep that in mind. What I want to talk about today is open government and health statistics, or as the secretary put it, liberating data, which I took a little offense at, because I thought in what we do, it was our prime directive to liberate the data, to get it out, to get it used. Okay? But it turns out that maybe we weren't doing as much as we could, and this is really the royal we. Well, this is the 50th anniversary of NCHS. Actually, it's not the 50th. We're now in 51 or 52, depending on how you count, but we've decided to celebrate for 5 years or so. I bring it up, though, because it's interesting in terms of liberating data or data in general to take a little look at the history of this. And NCHS goes back these 50 years, and if you go back and you look at the law passed in 1960, it talks about producing a reasonably current inventory that gives the state of health of the population of the United States, to produce information on planning to improve that health, information for research, and information about the disabled, okay, those who are not able to work. That charge is still, of course, relevant today, but we collect a good deal more information than that. We do it, though, in very much the same structure as was prescribed in 1960. But, of course, these activities, the Health Interview Survey, the National Health and Nutrition Examination Survey, the healthcare surveys, are conducted in very different manner than they were in the past, although they are fundamentally, at least the last two items here, health status and the healthcare surveys, are really based on the same idea of nationally representative information. Vital statistics, and they're done in different ways now than they were, of course, because of technology and advances in survey research. But unfortunately, the vital statistics is not done in such a different way. In fact, there are some parts of the country that are still sort of horse and buggy in the way we collect this data. We actually don't collect the data. We collate the data, which is collected by the state registrars. And some of the state registrars are really interested pretty much in birth and death certificates. Lately, birth certificates have received more attention than I've ever seen in the past. But for the registrars, that really is their business. And in fact, many of the registrar offices are supported by the sale of the paper certificates, okay, which I don't think is a way to run that railroad at all. We have made advances in terms of electronic birth registration, but death registration electronically really has a way to go. So this is kind of the structure of the data that we collect, and I emphasize the national, because for the great majority of these 50 years, the focus of the center has really been on national data. Okay? And it's only in the last decade or so has there really been a focus on state and community data. And I think this is really true for the last probably couple of decades for the country. This is what I consider to be the prime directives for NCHS. These are the same directives as the other federal statistical agencies. a focus on data for policy, particularly national policy, but more and more local, as community, state, and local policy, timely release of the data and doing it without favor, which means that as soon as we get the data in, regardless of who may have helped support it, the data goes out. So this is extremely important. And in this way, we really differ from many of the other federal statistical agencies which collect data, which may keep it for a while, use it, do research with it, and so forth. We don't do that. We do research with it, but not before anybody else does. We have to get the data out rapidly. So 50 years later, we are in a very different climate. I think the people who created the NCHS and wrote that bill 50 years ago were very prescient. There's no question about it. Okay, it really has stood the test of time. But what they couldn't have imagined, and I have a hard time almost dealing with, in a sense, is what's happened in the recent times in terms of the focus on data. About a decade ago, we produced a report. Actually, we didn't, but the National Committee on Vital and Health Statistics did, with a vision for data for the 21st century. In large part, this is sort of an extrapolation of determinants of health, if you think about it. And it's a good framework, but I think there's an issue or two with it that I will come back to hopefully before 9 o'clock, because at 9 o'clock you're all not going to be here. So I will try to move right along with this. I like this because it says where we are, but it also says where we aren't. So the data we collect is really in that sort of that yellow box, okay? And we collect a bit more around it, but as we go further away, we actually get less information. And yet, it's more and more important that we get that information that surrounds this. The call for data, data, data these days really is not emphasizing, I think, enough. Although I'll come back to the IOM report, recent IOM report, which does emphasize this. But I don't think there's enough emphasis on this, on other data.